Hello, everybody. So this second case study, I did neoplasia, and it's about colon adenoma and carcinoma. On my unit, we do a lot of screening and surgeries for liver cancers. We do a lot of colon cancer too, so I figured this would be very good research for me. Okay, so we have a 28-year-old white man presenting with a 3-week history of nausea, vomiting, abdominal pain, and bloody stools. Sigmoidoscopy reveals the presence of multiple polyps distributed throughout the colon and a 2 to 2 centimeter mass in the descending colon. An x-ray of his chest reveals multiple bilateral opacities in the lung fields. His liver is enlarged and appears to be nodular. Biopsy specimens are obtained of the colonic mass and several of the polyps. Family history includes a maternal uncle and maternal grandfather who died of colon cancer. Okay, so what could be the reason that the patient is having nausea, vomiting, abdominal pain, and bloody stools? For the nausea, vomiting, and abdominal pain, the polyps in the mass are causing major irritation in the gut. It's not supposed to be there, so of course it's going to be causing issues. The polyps could also be causing ulcerations, which can explain the bleeding and the bloody stools. So this is why when patients have bloody stools, we don't just think hemorrhaging. It's not usually superficial like the hemorrhage. Sometimes it could be polyps that can be causing issues. Why is it important to note familial history of colon cancer? So there could be gene mutations. The patient in this case study could have a gene mutation. We would have to check. Some patients can be born with mutations of an APC gene, which is the long arm of chromosome number 5. So all of their cells will be deficient in one of the 2 copies of the APC gene. These mutations cause genomic instability and predisposes mutations in other genes. The genomic instability, they're talking about the cell having genomic instabilities, which is going to predispose other mutations in other genes of other cells. What is the difference between benign and malignant? A benign polyp is called an adenoma, and they would be well circumcised, well differentiated, and non-invasive cells with no evidence of metastasis. Remember, differentiation has to do with how well the cell looks like other cells where they're biopsying and how well they function, how well they still have their cell functioning abilities. Malignant polyps are adenocarcinoma, and they will show irregular margins, poor differentiation, highly invasive cells with metastasis potential. So basically, the benign polyps are going to be easy to cut out, and the cells are going to look like other cells, and they're going to be functioning like other cells. The malignant polyps are going to be extremely irregular. They're going to be very hard to cut out, and they're going to be poorly differentiated, which means they don't look like any of the cells that they're supposed to look like in that sample, and they're not going to be functioning like the other cells are functioning. Why is the large nodular liver and the opacities of the lung important? Colon cancer usually spreads to the liver and the lungs, but primary ways that they spread through the lymphatics, they go to the lymph nodes, and then through the bloodstream, they go to places like the liver and the lungs. In this case study, it could be possible that there is metastasis because the irregular nodules in the liver and the opacities that are seen in the x-ray. What type of cells would we expect with polyp biopsies being sent? So normal differentiation of cells involves cells having clear vacuoles containing mucin. The epithelial cells of the polyp will have lost the specialized function of mucin production, and I posted some pictures in the next couple slides, so we'll look at that. So that's basically what we would expect. We want to see these vacuoles in normal cells. So if we send this polyp and their abnormalities or different size and shapes, then we're going to be thinking whether it's benign or malignant. Are there any tumor markers we could test for? Colon cancer is associated with carcinoembryonic antigen in serum. We could test for that. The only problem with testing this is that it's also associated with gastric cancer and breast cancer. So it's not like a specific marker, but it could tell us if they're high, if there's a cancer association. But with this case study, I would suspect that it would be metastasizing if we're already having issues with the liver and the lungs. Um, the the biopsy that we took in the colon, that would tell us obviously if we have colon cancer, but we would have to biopsy the liver and the lungs to see if that is the primary cancer, or if there are secondary cancers, or we would be testing metastasis. So that's what I would be doing with this patient, biopsying the other regions of suspected metastasis so that we can see where the primary cancer is, if there is a secondary cancer, and if this is true metastasis from the primary colon, so that we can start either surgery or chemo. Okay, so when we're looking at this picture, the more uniformed side of the picture, which is my left side, um, that is what the normal cells are going to look like. And then on the right side, the more abnormal cells growing is where the polyp is. So that's what, in a smear, that's what we would be looking for. So once we see this abnormality in cells on the right side, we would know it would be the polyp. So this cellular smear that we have on the left side, this is the polyp. You can see the abnormality in cell size compared to the membrane under it. But this would be a benign polyp. It's very uniformed, very easy to cut. The margins are very cut out. So this would be a very different than malignancy. On the right, the picture there, the little balls of redness are the malignant polyps. So that's what it would be looking like if they did an excision. So this picture, it shows a pleomorphism, which is cells and nuclei of irregular size and shape. So this would be a perfect example of a cell smear with a malignant cell type. So this is just a great picture for a malignant cell of the colon. They're very big, very irregular. The nuclei are huge. And this would be completely different than the benign ones that we looked at earlier. Okay, so stage 1 of colon cancer. These cancers have grown into layers of the colon wall, but have not spread to outside of the colon wall or to lymph nodes. Treatment involves polyp removal. If the cancer cells are seen outside of the margins or edges of the sample taken, then maybe you'll need more surgery. If when they take out the polyp, there are no cancer cells seen outside of the edges, then nothing else needs to be done and surgery was enough. Stage 2, these cancers have grown through the cell wall of the colon and possibly to nearby tissue but have not spread to the lymph nodes. Treatment involves partial colectomy and chemotherapy. Chemotherapy after surgery is recommended if the cells look very abnormal, and they call that high grade. If the cells outside of the margin, if there are cancer cells outside of the margin of surgical specimen, which we've talked about in stage 1, if the cancer was causing obstruction or if it caused perforation in the intestines. The chemotherapy that is usually given for colon cancer is 5-FU with leucovorin. 5-FU is the chemotherapy, and leucovorin is an agent that they give. I believe it's either a bladder protectant or a kidney protectant. I've given it before. This is a perfect example of chemotherapy that can cause secondary malignancies. The reason why they give leucovorin is because it's been shown to either cause bladder cancer or kidney cancer later on in the patient's life. So that's why they give these together so that it doesn't cause secondary malignancies. Other chemotherapies that they give for colon cancer is oxaliplatin and capecitabine. All right, so stage 3, cancer has spread to lymph nodes but not yet spread to other parts of the body. Treatment involves partial colectomy, removal of lymph nodes, and chemotherapy after surgery. Radiation can be used if these patients are not healthy enough for surgery. Now, stage 4, this is the spread to distant organs and tissues. Treatment includes surgery to all areas of metastasis, chemotherapy before and after surgery. So, pertaining to this case study, I think that if the patient did have metastasis to the lungs or the liver, then it would be considered stage 4. A lot of these colon cancers that reach this stage are non-curable. And really, if it's really bad, then chemotherapy is the only way to help with symptom management, because a lot of the time these tumors are huge or there's just too many. The most common metastasis with colon cancer is liver, lungs, brain, and the peritoneum. If the tumors are too large or too many, then we can help shrink them with chemo before surgery. A lot of these patients can possibly get a colostomy if it's causing too much blockage, or if the tumor is too large, or if they need to take too much out as far as the intestines are concerned. Patients with gene changes in their cancer could try immunotherapy drugs like pembrolizumab, which is an antibody that binds and blocks the programmed cell death protein. Since many of the cancers make proteins that bind to this receptor, they prevent the body's ability to attack the cancer cell itself. So immunotherapy would be very good, but it would probably just be for symptom management more than anything. Once it's at this stage, it's very hard to control. If we would have found this colon cancer in stage 1, then we probably could have put this patient into remission, but being in stage 4, it would be extremely hard to manage. Okay, so for Article 1, methanolic extracts of bitter melon inhibit colon cancer stem cells by affecting energy homeostasis and autophagy. So the article name doesn't really coincide with everything that they found that bitter melon does with colon cancer, but I guess they had to pick like a smaller name instead of putting like everything, so it's fine, but we'll go into that. So bitter melon is used in ancient Indian and Chinese medicine for prevention and treatment of diabetes. So basically the objective was to find whether it can have anti-tumor effects, which is what the article is about. So potential mechanisms that bitter melon has: 30-kDa ribosome inactivating protein termed Momordica or MAP30. It's found in bitter melon, and it has produced proliferation in cultured cells of breast cancer studies and showed anti-proliferative activity against prostate cancer in mice. All cultures that were grown in this specific study were done in 48 hours, and the human foreskin fibroblast is what was used with the bitter melon to see what they could find. So basically, this study found that bitter melon inhibits colon cancer cell proliferation. It caused S and G2 and M cell cycle arrest, which S is the synthesis part of the cell cycle, and M is the mitotic cell cycle, which is great for colon cancer because it can help kill the colon cancer cells in each of the cell cycle phases. It also produces autophagic features, and with this feature, it showed that the cancer cells were eating themselves, the colon cancer cells were eating themselves. However, it did not show apoptotic tendencies in these colon cancer. So it was like a weird article, but I thought it was super interesting because the fact that we could potentially use melon extracts to help with colon cancer, it's pretty awesome. But it was more of like a laboratory type study used in like cultured cells. So it wasn't like an actual study where people were involved who had colon cancer. But I mean, it's a good potential for more studies to come. So it was cool. Okay, Article 2, Cruciferous Vegetables and Risk of Colorectal Neoplasms, a systematic review and meta-analysis. All right, so it was a systematic review of 33 articles. The study showed an inverse relationship between these vegetables and colon cancer risk. The veggies that were included in the 33 articles were mostly cabbage, broccoli, and Brussels sprouts. Cruciferous vegetables have a unique source of glucosinolates that convert to ITCs, which have possible anti-cancer roles. So ITC is isothiocyanate. The mechanisms of this isothiocyanate include inhibition of carcinogen activating enzymes, inhibition of angiogenesis, induction of apoptosis, and arrest of all cell cycle progression. So pretty cool. So if these vegetables have such high incident of ITCs, then there's a possible anti-cancer role, especially with colon cancer. Broccoli was the vegetable that was shown to have most effects of anti-cancer role in most of these studies. The reasoning is because it's rich in phytochemicals that enhance antioxidants. The only weakness with this article that I found, it even says it in the article, is that there's more evidence is needed for the ITC levels. A lot of the studies, minimal amount of the studies talked about the ITC levels in the veggies. So we don't really have a strong relationship saying the ITC levels have anti-cancer roles, because a lot of these studies didn't even talk about the levels in their articles, in their studies. But this is kind of like a pilot study, a pilot systematic review that can show that maybe we need more studies talking about the ITC levels in vegetables and the inverse relationship that it has with anti-cancer roles. So it was a cool article. Okay, so Article 3, Efficacy and Safety of Compound Cushion Injection on Patients with Advanced Colon Cancer, a Meta-Analysis of Randomized Control Trials. So this was my favorite article, just because this was an article that was based off in China, and they're basically using herbal injections in addition to their chemotherapy products to see if this helps with their colon cancer survival rates. So this was a meta-analysis of 14 randomized control trials. It involved 1,145 advanced colon cancer patients. Their objective was to find whether their compound cushion injection was helpful as an adjuvant treatment alongside chemo. So this CKI is extracted from two different Chinese herbs, cushion and beituling. Hopefully I'm saying that right. I'm sure I'm not. CKI has various active compounds like matrin, oxymatrin, and sulforidine, which have anti-inflammatory, antiviral, antifibrotic, and anti-cancer effects. So it would make sense that they would want to have this as adjuvant therapy with chemo to help with colon cancer. The CKI mechanisms, they basically help induce tumor cells to normal cell differentiation, which we've talked about differentiation already. It helps with the function of the cells and for them to look more like their normal functioning cells. It also helps promote cell apoptosis and inhibit growth factor in neoplastic tissues. This study showed that CKI helped reduce nausea, vomiting, leukopenia, thrombocytopenia, and helped improve quality of life for these patients. The chemotherapy that they used in this study is the 5-FU with the leucovorin that we talked about, and the oxaliplatin, which we use for colon cancer in the United States. So it's interesting to see internationally what's done for cancer. So maybe we can incorporate that into our Western medicine. I think this is a great idea. I would like to see if this could work with a lot of our cancer patients. I mean, it's an herbal thing. It's not like it's immunotherapy. It's not an antibody. it's nothing like that. I'm sure that because it's an herb that there wouldn't be any side effects associated with it like there would be with the chemo and the immunotherapy. And I wonder if it helps with the chemotherapy side effects also. So, very interesting article. All right. Any questions? Hopefully, I was able to get my thoughts across. I felt like I kind of didn't, but hopefully, you guys understood me. So, if you have any questions, let me know. March is Colon Cancer Awareness Month. So, it's kind of cool that I did this now because March is coming up. So, all right. Have a great day, guys.